hygiene and dementia, toileting and bathing, some of the questions that we get asked about the most. Here's some information about us here at the James L. West Center. We do have a day program that's in Southwest Fort Worth, and then we are long-term care. We also have short-term rehab here, so if that's something you're interested in, please contact us. There's our objectives for those of you who are going to be getting that free CE today. Again, that's nurses, LPCs, and social workers, 1 hour free CE. We're going to start, those of you who've been on our programs, and many of you are repeats, you keep coming back because that's how we treat dementias with education. We need to understand the why. That's what we're all about. Let's understand the why. Why are they having problems with their ADLs, activities of daily living? Bathing and toileting are the two we're going to focus on today, but we're going to talk about the why. And the why is it's all going to go back to brain failure, no matter what kind of dementia your loved one has or your clients have. If you're a professional, you may have clients, patients, or residents. Their brain is failing. Their brain is dying. They're going from a 3-pound brain, you and I, we've got a 3-pound brain, eventually down to a 1-pound brain. So that brain is failing. That means that all 5 senses are affected. We're going to take sight, sound, smell, taste, and touch, and we're going to correlate it with these 5 A's, the 5 A's. So the 5 senses and the 5 A's. So you're on here, you're getting educated. We encourage you to take our slides. When you get these slides, share them with your families. Share them with the people that you work with. Leave them on our slides, please. But share them so that other people can understand why as well. They're not giving you a hard time. They're having a hard time. Dementia is not something they're doing on purpose just to make you mad, even though it can feel like it sometimes. I promise you they're not. They're doing the best they can with what remains. So keep in mind while we're going through this, dementia is brain failure. It's going to help you emotionally, and it's going to make it easier for you day to day. It's hard to hear, it's hard to think about, but there's nothing about dementia that's easy. And the more you know, the better you'll be able to walk this journey with your loved one. So let's think about those 5 senses to start with. When our brain is 3 pounds and it's working correctly, it pays attention to all of that stimuli around us, and it ignores some things that are less important. So let's say right now, while we're on this call, somebody started smelling smoke, like fire, something's burning smoke. None of us would just sit here and stay on the program. Our brain would alert us that we need to go check and make sure the house isn't on fire, and make sure that I didn't leave something on the stove, because we learned and made a connection that fire, smoke, danger. We made a connection. We weren't born knowing that. We learned that. As this disease progresses, again, regardless of what type of dementia your loved one has, there's over 100 different types, forms, or causes of dementia. Alzheimer's is the most common type. They lose that connection. There's a name for it. We're going to talk about that. All of us right now also, if we think about the external and the internal stimuli that's going on right now. Here, it's raining outside my window. I've got a noise machine going so that I don't hear everything, but there's somebody talking outside my door that's pretty loud. My lights are bright. Somebody must be heating some lunch up because I can smell it. And I can take all of those senses in, but I can correlate, this is coming from here, that's coming from here, and it's not a danger. They're going to lose the ability to do that. Notice that on the touch and feel, temperature is part of that. Most people with dementia stay cold all the time. That's one of the 5 senses. A normal, healthy brain recognizes, filters, and makes interpretations. A failing brain does not make correct interpretations. They might recognize, but the filter's gone. They might even see there's a fire in the microwave and go sit down in front of the TV because the correlation of danger isn't there. You can kind of see where we're going to start headed as we're talking about toileting and showers. Let's look at the next slide. So let's start with the 5 A's. Let's start with number 1, anxiety. Anxiety. Usually these A's will present themselves somewhere along the way with our loved one. It's a natural response to stress. We see a lot of it earlier in the disease when they still know that something's wrong or something's not right because there's fear, there's apprehension, anxiety. I'm a therapist, I'm a licensed professional counselor. Here's a pretty good definition of anxiety versus depression. Anxiety is when we're worried about what's going to come. It's the future. It's the what ifs. Depression is the woulda, coulda, shouldas. It's the past. When we're really hanging on to if I'd have only, if we just would have, what if we could have. So depression many times is the past. Anxiety many times is the future, the fear or the worry. When our loved one gets diagnosed, they may not act like they fully understand, but they've known for a long time something was wrong. I promise you they have. You know when something's wrong with your body. You know when you're tired or you hadn't had enough sleep and you kind of have a brain fog, but you know you need to get some rest. You know when you're starting to get sick. Feels like a cold's coming on. I wonder if I ate something bad. Because you recognize distress in your body. And I've had so many family members say, you know, once I started cleaning out the bathroom, I found all these vitamins where they'd been going and buying Prevagen and all the different things that are advertised to help with memory. Or I started finding notes everywhere where they were leaving themselves notes because they had anxiety. The second A is amnesia. We've heard of amnesia as being memory loss. Well, part of dementia is memory loss. Now, the word dementia doesn't mean memory loss. A lot of people will use the word dementia like it's a synonym for memory loss. There's so much more to dementia than memory loss. In fact, a person can get diagnosed with a few different types of dementia and not have memory loss yet, especially frontotemporal dementia or Lewy body dementia. It can present with no memory loss. They can have lots of other symptoms, and we've got entire programs on those. So memory loss, but think of all the different types of memory there is. There's short-term memory, immediate recall right now. What'd you have for breakfast this morning? I didn't even have breakfast this morning. And you know they did because you gave it to them. You watched them eat it. There's long-term memory loss, which the majority of the dementias, those long-term memories stay for a very long time. Some people go clear to the end of their life and they don't lose their long childhood memories. But there's procedural memory. Here's where we're going to come into toileting and bathing. We have a memory that holds procedural memories, the order in which I do things. So some of you might be making a connection right now. Oh, that's why I went in and they had their underwear on the outside of their pants. Or that's why they just went in and got under the water and got out. They didn't use any soap or shampoo. Think about how many steps are involved in toileting and in showering, in all grooming, getting dressed. They're losing the ability to sequence. That's procedural memory. And if I can't do it, I get aggravated and I get frustrated and I get mad. And it's your fault because my filter's gone. Because think about what I've got to accept if this is the truth. You heard Jamie talk about Dementia Live, that we're going to do a Dementia Live online. It teaches us that empathy. Stand in their shoes. Emotional memories stay. This is memories of trauma. If somebody has trauma in their past, they're doing what's called the theory of retrogenesis, and they will go back in time, and that trauma may very well come back. Now, that also means that good emotional memories can stay as well, where they can go back and relive some wonderful things that happened to them. But anything that you would consider an emotional memory stays because it stays on the amygdala, and the amygdala stays intact. Then there's aphasia.
And I think it directly goes into your.
Oh, okay. Aphasia. Some of your loved ones were diagnosed with primary progressive aphasia that might have been their first diagnosis. We see it a lot with FTD, frontotemporal dementias. Bruce Willis their family has come forward, and he presented with primary progressive aphasia. So, but aphasia also is part of dementia. Everybody eventually will develop aphasia. And look at what that is: the inability to express or understand language. We have two language centers in the brain. There's language on the left, and that left language leaves. That's our day-to-day language. It's what we're doing right now. It's our banter back and forth. That's why you can't just sit down and have a conversation with somebody with dementia. They're not going to be able to follow the plot of the show, and then we're going to discuss it. We're not going to be able to sit down. What'd you think about that game last night? What game last night? There wasn't a game last night. And you're stupid anyway, because you're reminding them that they don't know there was a game last night. We've got to learn how to communicate. But let's look at the other part of that. Understand language. So we say something like, go in the other room, get your blue jacket, and meet me at the car. We've got an appointment. And they heard go in the other room. And in the other room, there were some cookies left out. And in 5 minutes, you come out and they're in there eating cookies. There's no blue jacket, and they sure aren't coming to the car because they heard that first part. You gave them 3 things to do or 4 things to do. We learned to bring our sentences way down, get rid of adjectives and adverbs, and one step at a time. They may also start to use the word thing and stuff a lot. You know, the thing, the thing, the thing, the thing, the thing, and the stuff. You know, the thing and the stuff. So we then would say, what does the thing do? Can you show me some stuff? And they may point at what they want because they've lost that noun. But they also will lose the ability to understand what we're saying. And we have a chart, and again, we've got other programs more specific to this called the theory of retrogenesis, where we can get a developmental age on our loved one. It's called a FAST scale. Some of your doctors might use it. It's like a 1 to 7, and even some of them have 5A, 5B, 5C. You may have seen it before. We've got it. We can send it to you. I'll have Jamie send it to you. And you get a developmental age. So if our loved one is in the middle of the disease, a little toward, let's say earlier in the day, they're middle, later in the day, they're later, and they fall in a developmental of a 5-year-old, developmental age of a 5-year-old. You can tell a 5-year-old, go in there and get dressed for church because they can dress themselves. But they're going to come out maybe in their pink cowboy boots and a yellow tutu and a unicorn horn. Here we go, ready to go church. Because their developmental age is 5. They're not 5. We're not going to treat them like they're 5, but we're going to recognize, yes, they can still dress themselves with some guidance. Now, I mentioned the left language. There's also right language. And this stays. Right remains. And we can add to that, right rhythm remains. Rhythm, music, sounds with a beat. Our Father, who art in heaven, hallowed be thy name. Prayer, stored. Poetry, right. Music, of course, on the right. Use that music. Music from their past. Music from their childhood. Music from teen years, early 20s. Stays. A, B, C, D, E, F, G, 1, 2, 3, 4, 5, 6, 7, stays. But when we were really, really little, we heard 3 sets of words. All of us heard these words: curse words, racial slurs, and sex talk. Somewhere in our life, we heard those. And somebody told us to not say them because they're not day-to-day words. They couldn't store on the left because we didn't use them every day. So they stored on the right. And so curse words, sex talk, and racial slurs remain. And people who've never, ever said them before will say them to get their needs met. Not giving you a hard time, having a hard time. We're in the middle of the shower. I don't understand what's happening. I'm cold. What are you doing to me? I don't know you. I'm naked. I'm vulnerable. And here comes words you never even knew that they knew. What are they saying? What are they really saying? You got to think about these things. The fourth one, agnosia. This is that one I was telling you about earlier where they don't have the connection of what does that mean? What does that mean? The inability to recognize objects, persons, sounds, shapes, or smells, while the specific sense is not defective. The senses are still working. They change, but they're working. So for example, I mentioned the fire in the microwave. They put a fork in the microwave and there's a fire in it. They smell the smoke. They can even say there's a fire, but they don't do anything about it because the connection of that's danger is gone. It isn't there. They might hear the phone ringing, but where's that coming from? And the phone's sitting right there. I hear it because I can hear, but I'm not connecting that this thing is a phone because it isn't. If you're younger than 30, this has always been a phone, but for the rest of us, that's new learning because we grew up with house phone, either one that pushed buttons or some of us had the old rotary phones. I know I saw some of y'all shaking your head. You know what I'm talking about with the long cord. We'd stretch. That's a phone. That's a phone. Now let's look at apraxia. Listen to what this is. Unable to carry out routine motor tasks like tying shoes, brushing teeth, getting in and out of the car, sequencing. And that brain can't coordinate the steps. So you walk in, they're sitting on the bed and they've got their arms in their pants legs. Because I know this is clothes and I know I'm supposed to get dressed, but what goes where and how do I get? That's a lot of steps. We can do it in our sleep. We've got a 3-pound brain. This is where, under 5A there, the impact brain to tell the body to stay in balance, and it affects muscular movement, including the face. And eventually, they will develop a flat affect, where it looks like they're not there. They are there. They are always there because their amygdala is intact. Their hippocampus is dying. Amygdala is intact. They might not be able to make facial expressions, but they can read yours, your tone, your gestures, your mood, your body language. They will always be able to read you. About 80% of all those challenging expressions that our loved ones can have, and yes, you heard me say expressions and not behaviors, are either because of our approach or because of the environment. We are going to watch a super short video about the sensory changes, and then we will jump right in.
Hello. Today we're going to be taking a look at some sensory changes in dementia. When we think of dementia, we often just think of memory loss. And although this is a really big part of the disease, the damage to the brain that affects memory can also affect other things, including our senses. Now let's start by taking a look at changes to vision. To cope with poor processing capacity, the visual field narrows to reduce the amount of stimuli. This results in very limited peripheral vision. Another way the brain copes with limited processing capacity is by using monocular vision, so just using one eye. This affects depth perception, So it's not uncommon to see people with dementia failing to pick up objects or not quite reaching in the right place. Monocular vision also affects the way we process speed and movement. Even if approached at a normal pace, it can seem to a person with dementia that someone has just suddenly appeared in front of them. Another difficulty can occur over pattern recognition. Especially patterns involving lines or dots can be interpreted as moving, or interpreted wrongly, such as a circle pattern on the floor being confused for a hole. Dementia can also affect the way a person interprets sound. Damage to areas of the brain which process auditory information may limit a person's ability to understand long or fast-spoken sentences. People with dementia can also become hypersensitive to noise, meaning they can be easily startled by sudden or loud noises. They can also have difficulty filtering sound, resulting in noisy rooms becoming overwhelming. It could sound something like this. The next thing we're going to talk about is smell. People with dementia often suffer from olfactory hallucinations, smelling things which aren't there. The most commonly reported ones are burning rubber or toast. This can be distressing, giving a lack of orientation in a restricted environment. It is also common for things to start smelling different, less appealing, or overwhelming, causing a change in appetite. Another thing that affects appetite is changes in taste. Loss of taste buds alters how people experience food and may result in people no longer liking the foods that they used to enjoy. Finally, it's important to think about changes in touch. Some areas of the body become hypersensitive, while other areas become hyposensitive. Typically, the mouth, palms of hands, soles of feet, and genitalia become hypersensitive, with people reporting greater tenderness in these regions. Even water from a shower can feel painful. Conversely, limbs become hyposensitive, with people reporting less sensation in these areas. This can increase the risk of injury, as people may hurt and even bruise themselves and not realize. So that was a brief overview of some of the sensory changes you can expect to see in people with dementia. Thanks for watching, and we hope you enjoyed it.
Now, when we first got that diagnosis for our loved one, my guess is, unless you work in the field of dementia, you had no idea that that was part of dementia, that those changes to the senses were part of dementia. And it is. Their brain is failing. Education. That's how we're treating education. All right, let's jump into hygiene and self-care. These are private tasks. They're private tasks that we've been doing for ourselves for how many years? Think back. Today we're talking about toileting and showering. Do we even remember when we started to toilet ourselves? Or think back to your kids or grandkids. How old are they? My daughter was late. She was 3. I had one of those that was a slow potty trainer. But at 3, she was able to do everything for herself. I'd have to check on her. And a lot of kids, it's way earlier than that. Well, let's say your loved one now is 78. So for 75 years, they've been toileting themselves with no help. Think about that. How about showering? How old were you when you started to shower yourself or bathe yourself? We were probably pretty young. Somebody was watching, but they might have been telling us, make sure you get under your arms and let's get your feet and let. How many years has it been since somebody helped us bathe? So a big part of this is independence. So I will hear from family members, but I'm only trying to help them. Why are they getting mad? Why are they cursing? Why am I getting a fist when I'm just trying to help? Think about it. I'm independent. My dignity, I've been doing this forever. And if you're an adult child, you might get, I've been doing this longer than you've been alive. And they have been. There are things that we do without even thinking. From the time you got up this morning till the time you came on this call right now, think of all the things you did, brushing your teeth, combing your hair, maybe you took a shower, put on makeup, shaved, all those things. And you did not stop and think, now I need to get this toothbrush, and I know the name of it, and then pick up this tube, not that tube or that tube or that tube, and put it. You didn't even think about it. You can pre-pen brain. It's that ability to be able to perform that activity. And look at this quote. Everything you do for me, you take away from me. We do not want to jump in and start doing everything for them. In the early stages, reminders, setups, and cues. In the mid stages, support. That means help. In the late stages, we're probably going to be total care. But we still want to let them do as much as they can. Let's set them up for success. We want to make sure the environment is safe, it's friendly, it's familiar, and it's functional. We're going to talk about how to do that. We want to try to get our loved one to do some type of stimulation throughout the day. This is also for us, by the way. This is part of healthy brain aging 101. We need to stimulate our brain. And is sitting in the recliner in front of the TV all day stimulating? Now, some of you might say, why, yes, it is. It depends on what I'm watching. And it can be. But for 8 hours, 6 hours, you know, part of stimulation can be socialization. That's why we have things like a day program where people in the earliest stages can go and be with their peers. I've watched people with dementia talking in word salad, and they're talking back and forth to each other, having a complete conversation. But I'm stimulated and I'm with other people. We want to try to do things that use our gross and our fine motor skills. Those fine motor skills are going to go away pretty early. The ability to hold the pencil, the pen, the crayon, the marker, the fork, the knife, the spoon. They'll start holding it like we used to hold it when we were little. Going back in time. We also want to try to have a routine, and we're going to use some safety aids, and we'll look at what those are. So number one, we're going to talk about dignity and independence. We want to give verbal instructions. We want to do one step at a time and bring those steps way down. So if we're assisting a loved one, it might be this foot as I pat that foot. A visual gesture. If they're early in the disease and I'm just needing them to get a jacket on, I'm going to put my jacket on in front of them so they will mirror me. I had a lady, I used to help people stay home. I worked for the Alzheimer's Association. I helped people stay home. And her husband was having a hard time at the table eating. And I told her, sit directly across from him, square, and watch what you do, he will do. And it worked. It's not that he couldn't do it. He didn't remember the steps. Now the knife went away first because we learned the knife last. Think about how we learned to eat. Somebody fed us fingers, spoon, fork, knife. So the knife goes away first and then the fork goes away. They'll use that spoon a long, long time. And then they'll go to fingers and eventually they'll need assistance at mealtime. But let's do what we can to keep them feeding themselves as long as they can by themselves. And we want to use touch, compassionate, positive touch. You heard Jamie say we've got a program coming up that's called Compassionate Touch. We will teach you compassionate touch with your loved one. So make sure she's going to send you the calendar for that. So what does this look like? Verbal cues. Again, very specific, one at a time. Sit here and I'm patting the chair. My voice is up and I'm sitting down. Sit. Visual cues. Using signs or pictures earlier in the disease while they can still read and comprehend. This is a great thing to do. Now, there's going to come a time that they can read, but they won't comprehend what they're reading, and eventually they won't be able to read. But if they keep trying to go out the door, go get a stop sign and put it on the door. And you may be, where do I get a stop sign? Teacher supply stores. Here in Texas, in this part of Texas, we have stores called Mardell. And Mardell is an education, a teacher store, Christian store. And you can buy sets of like cardboard signs. You can also, our friend, Amazon. You can get everything on Amazon. Use signs, use pictures. You can put a picture of a sock on the drawer that has the socks in it, so that they can keep putting away the laundry, putting away the dishes in the dishwasher. They need a purpose and a reason. Demonstrate the activity and let them mirror or imitate. We talked about that. Touch cues, using touch to get attention. Like I said, this foot, and I'm tapping that foot. And then we're going to talk about something called hand under hand. This is guidance using palm to palm. I'm going to show you a picture in a minute. Teepa snow. If you've ever heard of Teepa, T-E-E-P-A, snow, go to YouTube, type in Teepa snow, and there are videos of her showing how to do showers, how to toilet, how to brush teeth. I'm going to show you some pictures, but you go find those videos. We don't have time to look at it today. Here's the pictures. There's Teepa. Teepa's the lady who's sitting down there, and you see it says, Teepa is in front of Amanda and within her visual range, but she's still slightly lower than Amanda's eye level. Think about why that is. Depending on where your loved one is in the disease, you know where they start to look? Straight forward and then down. It's pretty rare as the disease goes on that they look up. They just don't do it anymore. They look right here and down. They might get to where they turn their body. They almost stop turning their heads. So look where she is. It says Teepa connects with Amanda using a positive personal connection, perhaps giving her a compliment on her colorful outfit. Look at that pretty sweater you've got on today. And she's holding her hand out like a handshake, because we learned to take that hand when we were really little. It's palm up, the way she's giving her hand. It's palm up, because that is a choice. When we go for someone like this, that is a grab, and you might get one of those. You might get one of those this way, but you're more likely that they'll take that hand. And then look what she did in that picture there at the top. She gets them kind of like in a butterfly. And then look at that picture where now I can feed myself, even though Teepa's actually doing the work. I can shower myself. I can toilet. Again, videos, Teepa Snow online, all by using this approach. Other ways we can set them up for success. Be careful of our approach. And that's what we're talking about. Being respectful, maintain their dignity, using things like, let's do it together. And can you help me? Don't make it about them, making it about me. All of their senses are changing, and they're hypersensitive a lot of the time. You heard on that video what they might be hearing. If you do Dementia Live with us in a couple of weeks, we're going to actually play something to confuse your senses. We also want to always have everything ready and be flexible and be patient. Let's look at some of those challenges that come up. Now, we know that people can have dementia really at any age. I personally have known a couple of people that were in their late 20s and developed dementia. It's rare, but it does happen. So not everybody is 80, 85, 90, but a lot of people are. So let's think of that generation, the generation 80 and above. How many people in their entire life have seen them without their clothes on? Spouse, doctor, parent. They grew up at a time when we were modest. Now, this can be with anybody, but that next generation, the baby boomers, don't tend as a whole to be as modest. That was being a teenager in the 60s, 70s. not as modest. And goodness knows what this group of kids is going to be coming up. They don't wear clothes half the time anyway. So we really got a group coming up. But you're vulnerable when your clothes are off. And I might reach out with a fist or a spit, kick, bite, punch. They may do things like saying, I've already bathed, because time goes away because of where time's located in the brain. And they really do think they've already bathed. They may be so depressed that they, honest to goodness, don't care. And it can be uncomfortable. We said earlier, they stay cold. And now you want me to take my clothes off? They might be confused about what you're asking them to do. What if I know you and you come in and start taking my clothes off? They could misinterpret that for something else, especially if it's someone of the opposite sex. Their senses are changing. We learned the word no. Almost everybody, the word no was one of the first 5 words we learned. And I promise you, they will keep the word no until their dying breath. I've sat with almost 400 people as they've died, and they can still say the word no. Well into the end of life. Sometimes no, though, doesn't mean no. No might be leave me alone. Because let's say that somebody, I had this happen. A person had gout in their knee, and that person's knee was like a basketball, and it was red and it was hot. And we said, is your knee hurting? No. Let me help you. No. What were they really telling me? No was the word they were using. They were saying, help me, help me, help me. I'm in pain. They might be afraid of the water. It doesn't feel the same anymore. We always teach on the shower setting, make sure you have a setting. Lots of times it's called rain. It'll be called a rain setting. You or I might want the needle setting where it's beating on our shoulders. That is going to feel like it is tearing their skin off. Rain setting. That sound of running water can even upset them. So we want to keep it simple. So we call it KISS. Keep it super simple and sane and make it enjoyable. And the number one thing you can do for toileting and bathing is music. Toileting and bathing is music. Now it says they're toys. I'm not talking about little children toys, but if they have something they can hold, some type of something you can have in the bath. Keep it safe. Have that shower bench. Have a handheld shower head, and stick with their lifelong routines. If they've always taken a bath at night, don't switch them to a shower in the morning. That's not part of their routine. And I've got to start talking faster because we're going to run out of time. You're going to get these slides. Let them wear their glasses and their hearing aids. You be careful that those hearing aids don't get wet. Because you can imagine if I'm already afraid and now I can't see or hear. When you've got that handheld shower, you can control that. And there's other ways you can do their hair. You don't have to get their head completely wet every time. Look and see who's helping with the bathing or the toileting. Is it a child? Is it a spouse? Is it someone of the same sex? Ask yourself, who would you allow to help you? As a woman, do I want my adult son helping me toilet or bathe? Think about those things. Step-by-step instructions, act it out. A lot of people, especially early in the disease, that can still shower, you can stand outside the shower and you can do the motions and they will mirror you. Portable heaters in the bathroom or heat lamps installed in the ceiling really help. Other things that you can do. A full bath or shower is only needed 2 to 3 times a week unless they're soiled. You can do sponge baths, and we've got a picture here. They are big wipes. They look like a baby wipe, but they're big and you can warm them up. And you can tell them, oh, I got this new lotion. We're using a therapeutic story. Is it a lie? It's a little one. God knows the difference. Therapeutic story. Make their life easier, make my life easier. I'm going to get this. Let me get your back. Oh, that feels good here. You get right here under your arms, and they might can get in their private areas, and you're on standby. There's the no rinse shower shampoo. There's dry shampoo. We've got options. We can do bed baths. We can do sink baths. We can do a tub. We can do a shower. Let them participate as much as they can. Engage them by using their senses. Get something that smells good and put some music on. I have watched people with my own eyes 3 Elvis songs in and out because you'll get really good at it. This is a skill set you probably never wanted, but you'll get better at it. Here's some things that you might use. Bathing aids. Have that shower bench. This one that you see is called a transfer chair because you see that it's inside the tub and outside of the tub. So we can sit on it and kind of swing over in. A detachable shower head is good. There's some little stair steps. And then there's those long handled bath accessories if you need them. Let's jump to toileting. Let's look at toileting. Again, embarrassment. This comes up over and over in our support groups, especially if it's a spouse helping a spouse and it's the husband that has dementia. I don't want my wife helping me in the bathroom, and they can have a challenging expression. They may be afraid of falling into the hole because it's a hole you're asking me to sit down on. And you can tell them all day long, it's a toilet, it's a potty, it's a whatever. But you're asking me to make a connection and understand something that I don't understand anymore. They may have a physical ailment going on, and they will get to the point that they have a hard time communicating their needs. They are going to become incontinent. We were born incontinent. We were born not walking, not feeding ourselves, and not talking. That's where we're headed if they live long enough. So that isn't something they're doing on purpose. In the early stages, they usually do pretty good. They might have some accidents where they don't quite make it. Just like we learned to toilet, we unlearn toileting. You'll have some near misses, and then we start to become incontinent of bladder and eventually become incontinent of bowel. They can be really confused about where is the bathroom, and so they may go behind the door in a trash can. That's super common for someone to go in a trash can. In a potted plant, I've sure had some men urinate in dog bowls because it's there, it looks, it's water. So don't be surprised if it happens. Mobility issues, being able to get up and go quick enough, and just becoming incontinent is really, really hard. Don't scold them, humiliate them, laugh, or show your frustration. I said earlier, their amygdala is intact. They can read you. It's hard. Easy on, easy off clothes. There's a company, now you can get accessible clothes that you accommodate, but there's a company called Buck, B-U-C-K, Buck and Buck, and they sell these adaptable clothes that look like regular everyday clothes, but they Velcro. They're easier to get in and out of. You can also go on Amazon and find them. Label those bathroom doors. Keep your incontinent products together. A lot of people will have a little rolling cart. I've got a little cart here in my office. It's perfect. Little small cart with everything I need so I don't have to walk away. And then get a toilet schedule. And usually every 2 hours is good. Get a toileting schedule. You might be able to not go that often, but get a toileting schedule. Watch for those nonverbal signs like we do in a child. Are they we call it the pee-pee dance. Are they doing that pee-pee dance? Are they holding themselves? Are they tugging at themselves? And if you say, do you need to go to the bathroom? You know what they're probably going to say? No. So we're not going to say that. Let's go to the bathroom. I need to go. Come on, go with me. Because you know women love to go to the bathroom together. Come on, we're getting ready to do this. Let's run to the bathroom real quick before we do that. Come on. Not, do you need to go? We're never going to ask a question that way. Do you want to eat? No. Do you want to watch? No. No, no. I've known the word no longer than I've known the word yes. Put the food in front of them. It's time to eat. We're eating now. Don't decrease their fluids. They're already going to be dehydrated. People with dementia, dehydration it's common. They're going to start getting more UTIs. So don't cut back their fluids. Now you're going to want to, don't let them drink right up till they go to bed. So don't give them too much after dinner. Keep that toileting diary as well. We encourage caregivers to keep a journal of all the symptoms, expressions, changes, because you know when you get in there to that doctor, you're going to forget everything, and you've got 7 minutes, and you've got to tell them, have your journal, have your notebook, keep it in your purse, keep it on your person, because they may have a UTI. They might have something else going on that needs to be treated. If they have limited mobility, get a portable commode. Get one of the little portable toilets that you can take from room to room. Helping them sit down. Don't push them backwards. Have their back facing the toilet and have them hold on to a grab bar. If you've got those portable commodes, get the ones that have the bars. If you don't, have bars installed in your house. If you don't have somebody to do that, call your local area agency on aging. Many times there's money available and they will come out and put grab bars in. Lots of churches have ministries that will come out and put grab bars in for you. There's help out there. If you need help, contact me, contact Jamie. We can get you some information on that. You stand to the side of them and ask them, bend your knees, lean head forward. You talk them through and do it with them so that they copy you. If they're afraid of falling into the hole, put a towel over the hole, and as they start to sit, pull that towel away. Cover them up with a towel if they're cold. They can even, when you watch those Tifa Snow videos, she has people shower with a towel wrapped around them. Who cares? Does it really matter if they have a towel wrapped around them? They're in the shower. But if they're warmer with a towel wrapped around them and they're modest, let them have towel wrapped around them. And if your loved one is missing the commode, try a seat cover that's a different color, because you can buy toilet seats that are blue. You can buy toilet seats that are green. Get on Amazon, go online. You can find toilet seats that are a different color. You can also buy lights that go right inside the toilet. A lot of people have these so that when they raise the lid, a light comes on in the bottom so that we can see it. How do you tell if you've got a UTI, urinary tract infection? It may be bloody, it may be cloudy urine. It usually has a smell. Just a moment. Excuse me. We want to make sure that their private areas are being washed. And again, you can use those wipes for that. Don't put them in the toilet. Even though they say flushable, they're really not flushable. Make sure you're taking care of their skin. We don't want their skin to start to break down. Urine has a lot of acid in it. It'll start to break down their skin. The last thing we want is for them to get a wound or a sore. They don't have the reserves. It'll take them longer for that sore or that wound to heal. And sometimes it just won't. They become septic and they pass from becoming septic from a wound because they don't have the ability. They don't have the reserves that you and I have. Incontinence products. Let's look at this. Find the right product. There's pads, there's liners. Women usually don't have any problems with pads because they've used pads throughout their history of being a woman. There's protective underwear that look a whole lot like cloth underwear. Please don't call them diapers. You wouldn't want somebody saying they're putting you in diapers. Dignity, briefs, they're briefs. I've heard people use pull-ups. I call a lot of them fancy panties because they make them that are pink with flowers on them. That's our fancy panties. There are guards or drip pouches for men. There's those pads that you can put in the chair. There's waterproof mattress covers. Those adult wipes and cloth. Make sure you get a skin protectant, cream, lotion, disposable gloves, and get yourself a toileting cart. It might not be a cart. It might be something you carry, one of those carry. But a lot of people have little small push carts. And have a change of clothes that stays in the restroom. Always have a change of clothes in the restroom. And if you go somewhere, a lot of people carry a backpack. Take that backpack with you. You also want to keep your phone within reach if you're in the bathroom. A lot of people will use the phone to play music. One of our support group members talked about, and her husband was early onset. He was in his late 50s when he developed dementia, and he was mortified at her helping with toileting. She started putting his favorite music on and we talked about, it's not about the toileting, it's about the music. Let's get him to singing. Let's put on his favorite song while you're cleaning up. They can only have one thought at a time. And she came back and reported to the group, I can't believe that worked. He's sitting on the toilet. I'm assisting my husband on the toilet and he's singing at the top of his lungs. She was laughing through tears. Try it. And what doesn't work today might work tomorrow. And it might work next week. Keep your phone in reach in case there's an emergency. People can fall, even with you doing everything right, they can fall. Be careful. Have your phone nearby, because what if they fall on top of you? Get home health in. Ask for home health and get some professionals in there to help as well. Declutter. Get rid of all the stuff on the counter, even the toiletries, because you need to be putting out one thing at a time. Here's the toothbrush, here's the toothpaste, and it's gone. Here's the razor, here's the shaving cream, and it's gone. Here's the comb, and it's gone. So that they know what to use. You've got to take care of yourself. You've got to have breaks. You've got to have patience. You've got to have energy and strength to help your loved one, especially with toileting and bathing. That's why we have support groups. It is a skill set. It is a skill set you didn't want. We didn't want it, but it's one that we got, and you'll get better at it. And we've got 2 minutes. I am going through the questions. Thank you. So it takes a 60-second water only shower once a week. No soap, no shampoo. Other than the smell issue, how can this lack of proper hygiene negatively affect him? It very well may not. I mean, if he's not having any, they're 94 years old, and if he's not having any issues, you know, you might try just making sure that he's getting all the areas clean. Suggest using the wipes. You can talk about, I use them. I use these wipes. I thought this might, and you don't use them. You're telling a therapeutic story. You're making it about you, not about them. You can buy them cologne. You can buy them the deodorant. There's all types of products out there now for men. So, but if they're getting in there once a week, you're doing pretty good. And sometimes we just have to go, does it really matter? If they're not having the skin breakdown and that type of thing, you might go, okay, it's kind of like if they're sleeping in their boots. Hey, they're getting in the bed and they're sleeping. I'm not going to fight them on keeping the boots on. Choose your battles kind of thing. We are right at time. Anybody else have any questions? You can always email me, email Jamie. You will get a copy of this video, and it will be up on our YouTube page. You go to YouTube and type in James L. West Center for Dementia Care. We have dozens of videos on there. Right at time. Thank you. We'll see y'all next time.